Welcome back. The National Institute for Communicable Diseases is continuing to monitor the COVID-19 pandemic in the country. Today, the Institute reports 5,931 new COVID-19 cases and 79 deaths have been recorded in the country so far. We are joined now by Michelle Groome to talk more about the rise in infections. Michelle, thank you so much for your time this evening. I mean, when we're looking at the numbers right now, just under 6,000 new COVID-19 infections have been reported in the past 24 hours. But this is also considering the fact that it is a weekend. And when it comes to being able to gather some of this data in the weekend, we often see the lower numbers. But just from the NICD, what is your take in the way that we're managing this pandemic as it is right now?
So at the moment, we are starting to see some indication that the infection rates are in fact coming down. So last week we did see decreases in numbers. And as you rightly say, I think the weekends often are lower numbers, and we kind of look towards numbers on Tuesday, Wednesday to really see what was happening. And this past week, they were lower than they have been in previous weeks. So I think we are optimistic that we're starting to see kind of the downward trend kind of persisting. And I think, you know, this time around, there's been a lot of differences in the different provinces. So we know that, you know, Gauteng, Limpopo, Mpumalanga, and Northwest kind of started a bit earlier on, had quite sharp peaks up. And then if we look at Gauteng, has actually exited the third wave already, where some of the coastal provinces were a little bit later in terms of increasing infections. But it looks like they may also have kind of reached the peak and hopefully are on the downward trends. But we'll need this coming week, I think, just to make sure that these trends are persisting, as we've seen over the last weeks. You know, they started to come down, then seem to go up a little bit, but we're optimistic that the cases will be coming down.
Yeah, I mean, a lot of this has also been attributed to the fact that people are also trying to get themselves the jab, right, and getting vaccinated. However, we still understand that a lot of people are also suffering from, well, not suffering, but a lot of them are experiencing vaccine hesitancy. And in often cases, it's been cited that not a lot of information or proper, simple information has been adequately disseminated amongst the community so that they can make informed decisions about their bodies. Where are we getting it wrong when it comes to this messaging?
Yeah, I think it's just, you know, there's a lot of, if we look towards where we are at the moment compared to even 10 years ago, I think there's a lot more information out there. And I think, you know, getting the right information out there might be quite difficult sometimes. So I think it is, you know, that people need to be looking towards the right sources of information. And I think rightly so that we shouldn't just be relying on, you know, the Department of Health or the NICD to be getting information, and that we need to be relying more on communities and community activists to be able to, you know, to give the correct information to communities to allay some of these fears. Because I think a lot of the vaccine hesitancy is driven by fear, or, you know, by hearsay of other people that may have had an adverse event, and isn't really based on all the facts. So I think it is really important to get the good information out onto the ground.
Yeah. And speaking about information onto the ground, what do we understand so far about any form of possible variants making their ways to our shore, or new variants of the virus making their way to our shore? Because people are getting the jab, but many people want to know, is the jab that I'm getting protecting me against the variants that could possibly, you know, make their way to South Africa?
Yeah, sure. So, I mean, the variants of concern that we're aware of at the moment, and I mean, we've had the Alpha, Delta, and Beta variants, and thus far they are still very effective against severe disease and hospitalizations. Maybe not as the protection against infection is not as high, but definitely we're protecting against severe disease. Definitely there's going to be new variants. I think there was, we have in fact detected the C.1.2 variant, which I think was a lot in the press last week, and we had done a press release. So this is actually a new variant that has been detected in South Africa. But as yet, it hasn't been, you know, classified even as a variant of interest, and we'll continue to monitor that because there will be new variants that we detect, and it's very difficult to say, you know, whether these will be able to take over from the Delta variant, which is currently the dominant variant in South Africa.
And I wonder if you'll be able to answer this one around just how there are those reports of how efficacy almost seems to wane down after a few months or so of taking that jab. What do we know so far about that? Because, you know, there are those reports that as much as you are vaccinated, it does provide a certain amount of, immunity, so as to say. But over a period of time, we find that that moves from 97% to, say, 75 or less than that. What do we understand so far? Can you just give us clarity on that?
Yeah, so I think obviously in South Africa we don't have that that long-term data, but what's coming out from the other countries, in terms of long-term data, is that there may well be some waning of immunity. I think it's quite it's difficult to be able to know exactly kind of how the immunity is doing this. We've got immunity from vaccines, immunity from natural infection, and it's a new virus, and so we still need time to be able to look exactly at how the immunity actually is waning. Obviously, this is a possibility, and so we will, we obviously will be conducting effectiveness studies in South Africa to be able to have a look at this as well, and we're keeping abreast of literature obviously coming out from the rest of the world. And at this stage, it seems that for at least the first 8 months, you should still have good immunity, and you would still have better immunity than not having had the vaccine. Obviously, the possibility of boosters is out there, and so we would need to continue to monitor trends in infections. But at this stage, I think really important that we get as many people vaccinated in South Africa with at least their primary or first and second doses of vaccination, depending on the vaccine, because this will be providing protection at least against severe disease.
Dr. Michelle Groome, thank you so much for your time this evening. They are giving us the latest there in terms of what are we looking like where the COVID-19 pandemic is concerned in the country and how we're responding to it.